Yeah. Well, good afternoon, good evening, everyone. My name is Rocio Ramirez, and I am the Deputy Director for Imperial County Public Health Department, overseeing Community Health Division. I've been assisting with COVID response efforts within our Public Health Department, and I'm here to provide just a quick update, a very general update information to members. This is going to be short. I'm going to try not to get into so much detail as, I'm sure a lot of you have heard some of this information through other meetings, but I would like to provide a little bit of update as it relates to San Diego Regional caregivers and clients. I also want to say thank you to James and Lori and Hoa for hosting us and making this space available. We really do appreciate it and want to be accessible to try to inform our community as best possible. With that, I'm just going to begin with a very general update of our current situation as it relates to COVID. So in Imperial County, currently there have been a total of 26,817 positive cases that have been identified in our community of COVID-19. Of those, there have been, unfortunately, 584 deaths that have also been documented as it relates to COVID. This information is our Imperial County Public Health Department dashboard. There will be updates to our dashboard, so it will start looking a little different. A lot of the information will still be found there, but we're trying to align more with some of the metrics and the information that the state is also identifying, so that there doesn't create more confusion. But if you want to learn more about the status and information as it relates to the cases, case timeline, when we have the highlight of the cases, types of deaths, you can always visit our information through our public health website. And you're going to find that in there. If you go through our website, through the dashboard, you find, again, number of positive cases, our case timeline since our first initial case was identified last year. You'll find demographic information as it pertains to the positive cases that have been identified. As you see here, there's been cases among all different age groups within our county. Mainly the highest identified positive cases do remain within the age groups of 20 to 49 years of age. Of course, we do associate a lot of that within the age groups that are usually out in the field, either working and, out in the community. You'll find information about our deaths in our community, although, as you saw here, total cases are, there's a lot more cases in our younger population than our population over the age of 60. However, deaths do remain the highest among those over 60 years of age. So you can find additional information related to hospital, ICU status, and ventilator availability. I'm just going to show you where you can find this on our website. If you go to the public health website, there's a lot of information about COVID. You can find, if you click on COVID data, it'll take you to our dashboard and our numbers. It'll also provide you information related to state tier metrics, ICU availability, and other reports. Again, this may change a little bit as of tomorrow, but you will find similar information. In addition, we also have information related to COVID vaccine. You can find information as it relates to vaccine availability, depending on the targeted groups and who the vaccine may be available to. You can find our COVID tier schedule that identifies where are we now within our vaccination efforts and who qualifies or are listed under the different tiers and priority groups that are currently being vaccinated. So there's a lot of information, a lot of educational information. If you have any question, facts, data, and you can always submit a question if you have one as well. And we can always try to follow up and try to answer as best as we can. As it relates to COVID vaccine and prioritization, we follow the California Department of Public Health guidance as it relates to where vaccine needs to be allocated and what priority groups we need to focus on. This, of course, has been since the very beginning based on risk factors of those that work or are around or have the highest risk for contracting COVID or having severe complications for COVID. Although vaccine has been coming into our county very slowly, and because it's been coming in at a very slow pace and very limited amounts, that's why, you know, we've been expanding little by little. We started with phase 1A. Phase 1A focuses on our healthcare industry. Tier 1 started with our healthcare providers within our hospitals, those emergency responders like paramedics, ambulance services. In Tier 2, that expanded our healthcare industry a little further, which included other medical providers that are seeing patients, caregivers, and home health agencies and others. And then in our Tier 3, again, continuing to expand in our healthcare industry that included laboratories, pharmacies, and other specialty clinics. In our phase 1B, Tier 1, we have started vaccinating. We began with our seniors 65 and over. We started vaccinating them on January 18th. And we are continuing based on supplies, vaccinating supplies as they remain low. We're continuing to phase in the emergency services, education and childcare, and food and agriculture, which are all sectors that fall within our phase 1B Tier 1. Recently, early in February, a couple weeks ago, we received additional clarification from the California Department of Public Health. If family member caregivers of regional center consumers are eligible as healthcare providers for phase 1A. And the response was yes, family member caregivers with direct risk of COVID-19 exposure who care for regional center consumers at high risk for COVID-19 complications and related fatalities, including the following conditions: cerebral palsy, Down syndrome, epilepsy, and individuals who have specialized healthcare needs, including dependency on ventilators and oxygen or other technology, are eligible. It doesn't include family members within the same household that don't provide the direct care for that consumer. And eligible family members must obtain documentation from their regional center verifying the qualifying condition and the status of this caregiver. So with as this came out, and even before this clarification came out, we've been working very closely with San Diego Regional Center in preparation of coordinating vaccination efforts and opportunities for those that are eligible. We've been working with them in terms to make a vaccine available to those eligible family members, and we'll continue to do so as we move forward throughout the phases and eligibility continues to expand. In Imperial County, in the upcoming weeks, we'll continue to focus our efforts on wrapping up anyone that's still missing in phase 1A that hasn't had an opportunity to receive their vaccine. The remaining high-risk individuals in phase 1A tiers 1 through 3, including those regional center caregivers to be able to receive their first dose. I know that a lot of them were able to started getting their appointments early this week, and we'll continue to make appointments available in the upcoming weeks as well. We've also started conducting second dose clinics for phase 1A. Those that have already received their first dose vaccine are already scheduling appointments for their second dose as well. In the upcoming weeks as well, we'll continue to focus our efforts within the 65 and over population. Again, first dose and second dose clinics. We're going to start jumpstarting remaining phase 1B tier 1 sectors. As mentioned, working very closely with those liaisons for the emergency service, education and childcare, and food and agriculture sectors. And just as a side note, it's going to take us, we do ask for our community and those that are going to be eligible with, we need a little bit of patience. There's a lot of people that will be eligible to receive the vaccine, and we are still receiving the vaccine in very limited supplies. We don't have enough to be able to vaccinate everyone that is already, that could be potentially already eligible. So it's going to take us some time, but do know that we continue to work very closely with everyone that advocates, that works within these industries to try to create those opportunities and advance those opportunities for vaccination as the vaccine does become available. So more information coming within those sectors. Again, we're working with those liaisons within those sectors to receive that information for those that may be wondering when will they be next. Also, in the upcoming month, something that was also released recently by the governor was that beginning March 15th, as vaccine supply allows it, healthcare providers may use their clinical judgment to vaccinate individuals 16 to 64 who are deemed to be at a very highest risk to get sick from COVID-19 because of the following severe health conditions. That could be cancer, chronic kidney disease, stage 4, chronic pulmonary disease, oxygen dependent, Down syndrome, solid organ transplant, pregnancy, sickle cell disease, heart conditions. And these heart conditions does not include hypertension, severe obesity, and type 2 diabetes. If as a result of a developmental or other severe high-risk disability, one of the following applies, individuals likely to develop a severe life-threatening illness or death due to infection of COVID, or other inability to receive other vital services and challenges that may create challenges to some of these individuals might also be eligible. So again, this information came out very recent, so we're still working with the state to receive additional guidance, additional clarification, so that we are ready when we're able to roll out additional vaccine for and expanding some of these eligible groups. So we don't have all the answers today on how this is going to work, but do know that we're working on it. And as that information becomes available, we'll let the public know. We will be working with those agencies that work with individuals that may fall within some of these high-risk conditions, so that to ensure that they also provide the information to those that they serve, so that we expand our opportunities of information and collaboration as we continue to work towards getting our community vaccinated. The other thing that I wanted just a very quick update to provide was on schools updates and guidance. We're currently purple tier counties. We're currently in the purple tier, and schools may not reopen for grades 7 through 12 if the county is in purple tier. However, schools serving students K through 6 may not open for in-person instruction. Counties with adjusted case above 25 cases per 100,000 population. Our county is below the 25 case per 100,000 population. Therefore, it is possible that grades K through 6 may reopen for in-person instruction. In order for them to do that, they must post and submit a COVID-19 safety plan, and they cannot resume instruction until that is done and it's reviewed by the state, by the public health officer, and guidance is provided. So it is possible that some schools will start opening up. I know my understanding is that there has been at least 3 schools that have submitted their plans for review that the department is currently working with to reopen. And I'm sure we'll hear about more schools if there's an interest or the need to reopen, we'll be doing the same thing. Just as a side note, guidance continues to change. It changes on a daily basis sometimes. In the past, there was a criteria and a requirement for elementary schools to receive a waiver. That requirement was issued in August and allowed the local health officers to grant this waiver. All waivers that were approved prior to this date remain valid. However, it's no longer necessary for schools to submit a waiver as long as that the county meets the criteria, as long as they submit the plans, as long as they continue to work with the health department. If there's no issue with if there's any issues with the plans or their checklist or any of the requirements, they continue to work with the health department. They could open up within 7 days of them submitting their plan if there's no issue. Just for some information, there is a hub of information related to schools. If anybody has any questions, this is a website that the state makes available for school administrators, but it's also available for school staff and parents that might have questions as we prepare. As some of the schools prepare to open up in the event that parents have questions related to COVID and some of the safety guidelines and requirements that they may have. So just advising of that information that is available. And with that, I will wrap up my part of the presentation. I don't know if you have any questions.
Why don't we keep all questions till the end for an hour or so, and we'll let, if you want to either pass the ball to Lori or pass it back to me, and I'll pass it over to Lori so she can do her portion of the presentation. Well, actually, Lori, you don't have anything that you want to share on page, right?
Correct.
I just passed it to Lori. Sorry, Lori.
That's okay.
It's okay.
Hello, everyone. I'm Lori Robinson, and I'm the regional manager for the San Diego Regional Center here in the Imperial County office. I'm happy to be here to share information and hopefully answer any questions that any of you have. As Ms. Ramirez stated, we are working very closely with the health department, her team, and doing the very best we can to give you guys the most current information. So what I wanted to talk about this evening is a little bit about the process. So as Ms. Ramirez stated, that we are in phase 1A, and what's been happening is the individuals that have those diagnoses of cerebral palsy, Down syndrome, epilepsy, or a specialized health condition, we are contacting the family members of their loved ones and together determining who the primary caregiver or primary givers are. And from there, we are completing a letter that has your name on it or the parent's name on it. And with that, it will confirm that you as the primary caregiver are eligible. And then you'll go to the health department and obtain your vaccine. We know that autism and an intellectual disability is not on this phase 1 criteria, but as Ms. Ramirez indicated, we're hoping in later on we'll be able to get those folks and yourselves vaccinated as well. So the service coordinator, again, will be calling the families and discussing with them who the primary caregiver is. They'll have a letter that we will email or could even be picked up at the office. The workers will also help register the families if that's needed, and email isn't possible and they're not able to register. So we'll try to do that too. So I wanted to also share that we have around 35 service coordinators here at Regional Center, And on a monthly basis, you should be getting calls from them. What they're calling for is the health and safety of yourselves and your loved ones. And we want to know how it's going. We want to know if you had the COVID test, what the results were. Some of you may have had the vaccination from a primary caregiver or some other way, and we would want to know that also. We've done a really good job at providing PPE supplies, and Mr. Gonzalez and his team have also done the same thing. So we've had, I don't know how many events so far, but we also have available, if anyone wants to come here and is low on supplies, to pick up PPE supplies on Tuesday between 8 and 9 and Thursday between 3:30 and 4:30. So if you give your service coordinator a call or they contact you and you say you're getting low on supplies, you can come by our office and we can make that available to you. If those times don't work, we'll figure something else out. So that's the process with phase 1A. And again, it's with your loved ones that have those particular disabilities, CP, Down syndrome, epilepsy, or some healthcare condition. We have heard that some families have been able to have their loved one who has autism vaccinated, and perhaps that individual had autism and Down syndrome, or autism and a health condition. So what we do know is for phase 1, these are the folks that are eligible right now, the primary caregivers. As Ms. Ramirez stated, it's very exciting to know that March 15 we'll have more opportunities for people to be vaccinated. One of the reasons this happened is because all the 21 regional centers and advocacy groups and families, et cetera, have advocated to have persons with disabilities included higher up than lower on the tier level. So this is great news. Again, we may have lots and lots of people that are eligible, but the vaccines are what they are here. So even though we have people that are eligible to get one, we know that realistically they may have to wait because the limited number of vaccines that we have. And as Ms. Ramirez stated, we just want you guys to be patient. We know that we'll all get one eventually. So that's my thing with Regional Center and what the process is.
Lori, if I may add to that process, just as a reminder that the links to register for their appointment are also received by San Diego Regional Center, that are sent to those that are eligible, that are being contacted. We don't have those links on our website. Those are to be received directly through San Diego Regional when they're getting their letters stating their eligibility and providing all that. All those instructions will be provided by the regional center. The other thing I just wanted to remind people is related to the second dose, as there may be some care providers that received their vaccine, not necessarily as a regional center family caregiver, but maybe through in-home support services, because they might also be an IHSS worker. IHSS, we started vaccinating IHSS workers earlier on as well, because those were also listed under the phase 1A tier 2 group. So with second dose, once you receive your first dose vaccination, you need to receive your second dose with the same provider where you receive your first dose. So within the public health department, we are scheduling specific second dose vaccination clinics, curbside clinics, similar to the first dose, but we don't mix and match. So we do first dose clinics and we do second dose clinics separately. They don't take walk-ins. You have to have an appointment, and those are obtained through those links that are being shared. When scheduling the second dose, depending on the type of vaccine that you receive your first dose, is the type of a clinic that someone must register. So if you register for, if you received a Moderna vaccination, then you need to get a Moderna second dose vaccine. For Pfizer, The time period to get the second dose is within 21 days from receiving the first dose. And for those that receive Moderna, they can receive their second dose within 28 days of receiving their first dose. It may be that you're not able to get your vaccination exactly within those 21 days or those 28 days. And that's also because second dose vaccine is also coming in slowly. And coordinating those clinics can take some time. So anyone that received their vaccine through the public health department will be receiving an email with information on how to register for their second dose when those second dose clinics are available for that person. A second dose of COVID vaccine may be scheduled for administration up to six weeks or 42 days after receiving their first dose. And so the efficacy still remains, even if you get it after those 21st or that 28th day. So it doesn't have to be exactly that same day. We encourage, and everybody encourages, to get it as close as possible to that day. If it goes past a few days, it'll be okay. You can still schedule your vaccine. If you're unable to schedule your vaccine and you go past the 42 days, you'll still be able to schedule your second dose vaccine, and you don't have to start all over. But we'll try to get you in and make those opportunities available as close to the date as possible. Thank you.
Thank you for that additional information. So I think we'll take questions if there are any.
We only had actually, just seems like board members have logged in, a few others here and there that were able to get in. It didn't go Facebook Live, so I'll have to post this later. So this Rocio will be more informational than any. But if anybody wants to raise their hand, I can unmute them. Anybody have any questions? Okay, Naomi says, great info, thank you. That's Naomi Soto. Anybody else have any other questions? I'm not getting any information from our attendees as far as any additional questions. Is there any additional information that any of you ladies would like to provide, or anything that could be a helpful hint for family members and those going to receive vaccines to be mindful of, to lessen the frustration?
I think just to be patient and know that they will receive one. Also that not to just, like Rocio said, not to just show up at the health department, because that's going to be frustrating when you won't be able to get one without an appointment. We have had people go to San Diego with one of the letters that we have from Nancy Bargeman, who is our executive director for the Department of Developmental Services. And many of the families who live in San Diego were able to get the vaccine there. And there may be some folks from the Valley that could have gotten one in San Diego, but we're not encouraging families to go to San Diego just in case they're not able to get the vaccine because they might have a different county code like Imperial. So it's I think it's important to go to the website and find out the best and most current information, so you're not running around and being disappointed that you weren't able to get it as soon as you wanted. And we want to hear from families. I know that the service coordinators, when we are calling, we want to hear from families, how they're doing, if they need any supplies, if they've had the COVID test, etc.
The other thing that I just wanted to mention, because I know that some people may still be uncertain about getting the vaccine or be afraid of receiving the vaccine. There's a lot of information out there. There's a lot of misinformation out there. Just, go to a credible source of information. You can go to the California COVID-19 COVID website, and they have a lot of information as it relates to COVID, as it relates to guidance, as well as prevention and vaccine as well. If there are specific questions related to vaccinating someone with specific medical conditions, consult with the medical provider or with your primary medical provider so that you feel comfortable, and if it's appropriate for you to get the vaccine. I know that there hasn't been a lot of reports of any major issues related to side effects or allergic reactions to COVID, to the vaccine. It is something that's being tracked. It's something that continues to be ensure that, we try to ensure, or not just us, the state, the federal government is monitoring very closely for any potential side effects or any issues with the vaccine that could be harmful. So know that it's being closely monitored. It has always been closely monitored. Although in California established a scientific review committee that reviewed all the information that was, when it was approved by the FDA, when it was approved by the federal government, it still went to an additional layer of review to ensure the safety for those residents in California. And these people that reviewed it are experts in the field, working with immunizations, working with different scientists, people that have been around for a very long time. So, it went through every effort to try to, ensure the efficacy and the safety for the community. But again, if you have any concerns, I encourage people, whether it's you or your loved one, when the vaccine becomes available for your loved one, especially if they have a specific medical condition, consult with your primary doctor or with that person's primary doctor if there's any concerns.
Okay, Rosa, I think these two questions came in for you, and I'm going to say them both because they're kind of intertwined. So Luis is, what are the plans for children? Will there be an age bracket? And like I said, it's a similar question. Is it true that they're lowering the age bracket on children to receive the vaccine? I know Pfizer is 16 and over. So those two questions are kind of intertwined.
Yeah, so Moderna is 18 and over and Pfizer is 16 and over, I believe it is. And currently the vaccine is still being, they're going through trials. So we don't have any information as to when the vaccine may be available for children at a younger age group until we have more information or that's released and approved by the federal government. And by the state government, we'll be able to share that. Again, as vaccine becomes available and it's expanded in the different age groups, we'll share that information with everyone.
I don't see any additional questions at this time. Like I said, we only, because of the glitch that we only had a few people come in. So what I'll do is once we have this meeting set up, I can always share it on our other channels, YouTube and Facebook. But like I said, it's just a glitch that we're having. Is there any additional information that you ladies could provide right now that we have the forum open? Any questions that you think parents might have that they'd want answered?
Lori, I mean, I don't know if, are you getting specific questions from parents that we can help with?
No. Oh, there's a question.
What about teachers getting vaccinations?
So we're currently,
education.
the health department is currently working very closely with the county office of education and the different sectors in the community to get a plan and effort in place in terms of vaccinating teachers. Again, because of the limited amount of vaccine, it's going to take a while, and it'll be, the teachers will be, those educators, because it's everyone, it's not just teachers, is anyone that works within the schools technically becomes eligible. And so they will be rolling out in a phased approach, starting with the highest risk and additional, they're still finalizing those plans. So if there's any question as it relates to teachers, I would encourage them to talk to whether their school district, to see about additional information as to what plans are currently, what are the plans that are currently being talked about, or you can reach out to Imperial County Office of Education as well for further information.
So I would say this next question is more directed to San Diego Regional, but I think Rocio can fill in the blanks also. Can our son receive the vaccine if he's 16 and epilepsy? Do I have to go through San Diego Regional as well?
Yeah, so my understanding is beginning March 15th with this new directive, because it's 16 and over.
Right,
Pfizer.
right. So right now, so yes, that is accurate. Right now, we don't have, we're not vaccinating anyone under the age of, between the ages of 16 or 64 with medical conditions. That will become available, and we'll provide more information once it's expanded after March 15th. Again, it's all based on availability of supply. So it doesn't necessarily mean that on March 15th, that vaccine will be available exactly on that date, but we'll ensure that we'll communicate with the community about how that process will take place, where people can receive their vaccine, and how soon after March 15 they can receive or start looking for opportunities to receive the vaccine. We will be continue to collaborate and communicate with San Diego Regional, as well as other providers, other organizations that work with people with special needs or with different medical conditions, qualifying medical conditions, to ensure that their clients or their patients receive the appropriate information and have that available. So as those plans, as we have more details of how that will be administered, we'll let the community know, we'll let San Diego Regional know, so that way they can communicate with their clients.
So as of right now, anybody that is a San Diego Regional client and has one of the three, including, let's say, epilepsy, that's tentatively set for March 15th.
After March 15th.
Yeah, is that what we're looking at? Okay.
Yeah, anyone that's a San Diego Regional client that's over the age of 65, they can consult and see if their medical provider has any vaccine. As I mentioned earlier, there's additional providers that are starting to receive vaccine. There are certain pharmacies that are starting to receive vaccine. The health department is not providing vaccination for 65 and over at this time at their site. We're focusing more on employers and vaccinating the employees at this time. We do vaccinate 65 and over when we do the mass clinics in coordination with the county and other partners. So that's another opportunity for individuals to get vaccinated. So again, I welcome you to visit our website to find out more information and locations, or some of the approved providers that are receiving or have been receiving or may continue to receive vaccine. The list that's currently on our website is limited and is being expanded. So we're waiting on confirmation if the providers actually receive vaccine this week. Again, there was a delay in vaccination being received this week because of the weather in the Midwest and
Mhm.
everything that's happening, that's delayed vaccination through our county and everywhere in California. I'm sure everywhere in the United States. So, you know, check with the medical providers, check with the pharmacies. Again, that list continues to be expanded, and we'll try to make it more available.
I think the earlier question regarding a child and the vaccine, we do still have a lot of free clinics where you can go and at least get the vaccine test. And I think that would be helpful. So if your loved one that's a child is positive, then you can go ahead and quarantine your loved one and make sure that they're safe and, you know, wearing all the mask and et cetera. So I think that would be something to continue to do if you have a child and you're concerned. I know that doesn't protect them from COVID, but at least you would have an answer whether the person is positive or negative. We do have people that have gotten the COVID test who are shocked that they tested positive because they were asymptomatic and had no symptoms at all. So in that respect, it's really helpful to have had that test. I think now we're not really putting it up the nose. Now it's just counting to 10, and it's not really that intrusive to have that test done.
And you can find, again, on our website, you can find information of where to find COVID testing that's accessible. You can do it based on zip code and what's the closest to you, so that, you know, to find different opportunities. You've also probably seen that mobile bus that goes around and goes through the different cities. It's been around the community, around the county, and that's been made available through a state partnership. And that provides COVID testing. And it's been a great opportunity and accessibility for people. It's free. There is no cost for the test if you get it through that site. In most sites, they don't charge you. If you have insurance, they'll charge your insurance. But if insurance or ability to pay should not be an issue. And that's the same thing for the vaccine. Just as a reminder, the vaccine is free of charge. You may be asked to provide insurance information, and that is because providers are able to charge an administrative fee. So for providing the vaccine, and it's a small administrative fee that they can charge, but the vaccine itself is not charged. It's free of cost at this point. There's no plans for the government or for the county or the state to charge anytime soon that we have heard of. So just know that. And if the person doesn't have insurance, that again, that doesn't limit the ability for someone to get a vaccine when it is available to them.
I did mention that San Diego Regional Center also was, we are considered a COVID testing site. And so we just actually had a couple of COVID test sites. We had one the other day. I think it was this past Tuesday, and they had one at the strike zone at the bowling alley. So these are also free if any of you want to go. If you're affiliated with Regional Center and you want to go get a COVID test, we'll make sure that you folks know when the next one is and where to go.
Yeah, I've been getting those through our email, so I definitely share them with our board members, and I put them on our Facebook page.
Thanks,
to make
James.
sure that everybody's aware whenever another event comes up, so that way they can check for a COVID test and see how they're doing. So other than that, I think I don't see any more questions. I think we've got everything just about covered. Again, ladies, I'll ask you, is there anything else you would like to add at this time before wrapping it all up?
There's nothing. I don't have anything. I mean, we keep saying, stay safe. Remember to continue to stay home if you can. If you don't need to go anywhere, remember to use your face coverings and wash your hands and keep your loved ones safe. When the vaccine is available, we encourage you to get the vaccine to continue to protect your family. And if you have someone that's over the age of 65 that needs a vaccine, help them get registered in the different locations. You know, we have that campaign of help us, help them, as it's difficult for a lot of the senior population to navigate through, you know, websites and internet and registration online. So anything that we can all do to help them out as a community, especially those that are close to us, to ensure that they're protected, to ensure that their information is also protected, and as we're getting them registered and getting vaccinated. And that's all. Thank you for having us. And again, we are here to support our community and be here for our community as much as we can.
I wanted to thank James. I think he's an awesome president, and I also wanted to give a big shout out to all of you in the autism support group for the outstanding collaboration that all of you have done with the regional center. I don't know, I assume you guys know that Mr. Gonzalez has done lots and lots of PPE distributions in some of the remote areas. He's had some of you folks that have participated in our huge events. We've had like 400 cars driving through the parking lot. I can't remember how many we've had, maybe a dozen or so, James, but we could not do this without your efforts. So I just wanted to acknowledge and thank all of you for that.
Yeah, we've got some board members on here too that have definitely helped us out. You know, it takes a team, right? And I've got a good group of board members helping us out and making sure that we can, you know, get this out there. We're working to schedule a couple more events in the coming weeks. So I know PPEs have been short, so now that they're available again, we'll work hard to get out there. I'll get with Joab, who is doing our Spanish translation today, and set up when we got those dates so I can pick up supplies and get out there again. Just a quick reminder, everybody can find information in regards to the health department on their website. It's really easy. Imperial County Health Department, all their initials, icphd.org. And for San Diego Regional, they make it easy also, sdrc.org. So if you have any questions, of course, you can go directly to their websites and find information there. As far as family members who have questions, remember, with San Diego Regional, you can always contact your coordinator. They'll be more than glad to provide you with information. Is that right, Lori?
Yes. And if they don't know, they'll find out. Get back to the family. But yes, hopefully, yes, please do. Please contact us.
So she'll put the website there and the phone number if you have any questions. 442-265-6700 is that county COVID information line. So if you have any questions in regards to that. Ladies, thank you very much. Joab, you're there in the background. Thank you very much. We appreciate it. I won't tell Lori what you said about her.
Thank you.
Nails, all the lovely things you say about her all the time. All right, ladies, you have a great day. Everybody that joined in, thank you very much. Thank you for pushing through with all the technical difficulties we had at the beginning. I appreciate it. And we'll see you soon. Thank you very much. You guys have a great evening.
Bye.
Bye.
Thank you.